The U.S. Census Bureau tells us there are over 80 million men and women making up the millennial generation. That's 25% of our total population. With health specifically, which questions should millennial women be asking? Barb Dean is a practicing women's health nurse practitioner, award-winning author, and a nationally recognized health expert. It's good to see you again, Barb.
Great to be here, Mary. I love it.
We are in the midst of the 50th anniversary of National Nurse Practitioner Week. How important are nurse practitioners in the healthcare field overall?
Well, Mary, you might be surprised to learn that over 30 million women in the U.S. access medical services to talk about sexual and reproductive health, and there's 10,000 nurse practitioners like me who specialize in women's health, and we're ready to meet those needs.
So let's talk about counseling. What's the role then of nurse practitioners when patients come to them?
We love counseling. We're all about prevention. We like to talk to people about, are you getting enough sleep at night? How's your diet? What about your exercise? We want people to be healthier, and we're all about prevention. We also like to talk about what's new. And one of the things that's new for millennials are there's long-acting reversible contraception like implants and IUDs.
So there are three questions, and maybe this ties back to what you were just mentioning. But as a professional, you want people to have, like, for millennial women specifically, as they go into their primary medical professionals. So what are those three questions, Barb?
So number one, how often should I be coming in to see you? Number two, what kind of screening tests do I need? How often do they happen, and what are they? And number three, what should I be thinking about when I'm making decisions about contraception? And one thing that women may want to consider is the Skyla IUD. This is a progestin-containing IUD. It's completely reversible. I brought you one. It lasts for 3 years, and it's over 99% effective. That means that when women want to have it removed, it's reversible. There's no waiting period, and if they want to start their family, 3 out of 4 women who had the Skyla removed were able to conceive within the first year.
What are some of the barriers to access? I would ask that question really with anything, anywhere. What are you seeing?
Well, as a nurse practitioner, we don't want women or men to have any barriers to access to health care. And with the Affordable Care Act, many women are surprised to learn that their birth control is no cost. Now, for women who are having trouble navigating that system, there's a free service called coverher.org that can help women navigate not only birth control options, but also healthcare options now.
At what point do you think women should start talking to their doctors about family? Because, I'm one of those, I guess I'm a millennial. I don't really think about myself in those terms where I'm always texting, and so some of those things that the generation is criticized for. But I guess I fall into that age range where professionally you make certain choices because you want to go out there and chase your dreams, and then family comes a little bit later on. So at what point do you start talking to your doctor if you are thinking about kids?
Well, I think anytime, every woman is different, and every woman needs different things at different times in her life. And so some women may want to start contraception much earlier, and some women may want to start their family earlier. So there's no one right or wrong answer for any woman or any millennial. The point is, do talk to your healthcare provider about what's best for you. What are the benefits, and what are the risks, and what are the things that might work best in your lifestyle?
I like the idea of talking about it, right? And that's part of why you wanted to come on today, was just to encourage women to talk to their doctors regardless of what they prefer. Barb, thanks for joining us today. We appreciate it.
Oh, you're welcome. And do talk to your nurse practitioner, your OBGYN, or you can go to skyla-us.com for more information. Thanks so much, Mary.
Thank you, Barb. Mike?